Hello. Up to 1 out of every 10 critical care patients experience symptoms suggestive of post-traumatic stress disorder, or PTSD. This is a psychological disorder that can develop following exposure to a traumatic event. Symptoms include flashbacks, feeling as if the episode is happening again, increased anxiety, and avoiding thinking or talking about a situation. It is quite common to experience some of these symptoms after a very stressful experience, but they normally become less frequent over time. In PTSD, these symptoms do not get better over time and can even get worse. PTSD can have a very negative impact on your quality of life. However, there are successful treatments available. People with PTSD often require expert psychological therapy to help them move on with their lives. We use a screening questionnaire in clinic to help diagnose this problem, and if PTSD is suspected, we can arrange expert help.
When I finally left ICU, went home to start my recovery process, and I had Jeff, and he was amazing, absolutely amazing, but I struggled a lot with trying to get my head around why this happened. What did I do wrong? Was it me that wasn't careful about my own health? To be fair, I still struggle now to get my head around it. And I did his head in, because all I would do was ask him over and over again, what happened? Why did it happen? And then 2 hours later, I'd ask him again. And I just couldn't wrap my head around it. I struggled physically, emotionally, mentally, and it wasn't until I saw my psychologist, Hannah. She said that it's PTSD. I'd have flashbacks, panic attacks, anxiety, nightmares, and it was horrendous.
With that, we had about 9 sessions with her.
Yeah.
Which she then went through everything that happened and basically went back to scratch and went through with both of us everything that happened, and we both found out that what we were feeling was normal, and that was a very important part, that you do get people think seeing a psychologist you've lost your mind, but the word psychologist means help, and that was very, very helpful to both of us.
I was quite stubborn at the start because I didn't want people to think I was crazy. I wouldn't talk. But Hannah had a way of making me feel so comfortable and just explaining over and over again that it is normal and other people do feel this and experience this. And I then felt it was okay to open up and work with her and work with Jeff, you know, and get help Jude on how to deal with me, because it's frustrating for you, isn't it?
Yeah.
But yeah, it helped both of us, and PTSD isn't a scary thing. It might be at the beginning, but once you know how to handle it and get through it, it's not that scary. It's just another mountain you have to climb and get over. It makes you stronger at the end of the day.